How to clinically examine the popliteal artery like a pro? A well-examined artery tells more than a scan sometimes. Let's break down how to examine the popliteal artery, often overlooked but clinically crucial in vascular surgery, trauma, and peripheral arterial disease. Why examine? It's a deeply located vessel, common site for aneurysm and occlusions, and important in trauma and peripheral vascular diseases. Now, talking about the positioning, patient is supine with the neck flexed to 30 to 40 degrees to relax the fascia and muscles. First method is bimanual palpation, and it's the gold standard. Thumbs on the anterior side of the knee and the finger on the popliteal fossa from behind. Press deeply against the posterior surface of upper end of tibia. Feel the broad transmitted pulsation. Here is the tip. Normally it is difficult to palpate, so compare bilaterally. The other alternative method is prone position. While the patient is in prone position, knee is flexed to 90 degrees. The fingers in the popliteal fossa and press against the lower femur. It is useful in obese patient. Another very useful method is the Fusyk test. It is also called as cross leg test. The patient sits while the legs are crossed and we have to inspect the leg. Pulsatile movement of the leg suggests that the popliteal artery is normal. Now, what are you looking for? Pulsatility, if it is diminished, absent, or bounding. In case of aneurysm, there will be expansile feel. There can be tenderness or thrill, especially in trauma and AV fistula. Always compare it with the distal pulsation like dorsalis pedis or posterior tibial. Now, the key clinical significance is that popliteal artery aneurysm is the most common peripheral arterial aneurysm. Missed, it can lead to thrombosis, embolism, and life-threatening ischemia. It is often bilateral. So, quick recap is patient relaxed, knee flexed. Bimanual depalpation, check for thrill, expansile nature. Always compare both sides. Follow up with distal pulsation and ABPI, that is ankle brachial pressure index. Mastering the popliteal artery exam is not just about feeling the pulse. It's about feeling the future of the limb. Don't skip it.